Lynn Myers is an Estes Park retiree who comes to Estes Park Health 6 days a week for lab tests or infusions of blood products to treat his bone marrow cancer, Myelodysplastic syndrome, which is now in remission. He's one of many patients who enjoy the personalized treatment they receive in the Infusion Center.
If it hadn't been for this, we'd have left 2-3 years ago because you can't. We couldn't drive to Loveland or Longmont and back every day.
Lynn's wife, Kay, sits by his side. She has donated warm quilts to the Infusion Center for other patients who may get cold during their therapy.
This staff is wonderful, and I know he's well taken care of.
For Kay and Lynn, having infusion services at Estes Park Health means the couple doesn't have to move away from Estes Park to get the life-saving care Lynn needs.
And if I had to do all that driving, we'd be down the mountain. We would not be up here. As long as we can stay up here and be here and have this here, it's really great.
In addition to cancer patients who need platelets or chemotherapy, Estes Park Health's Infusion Center also delivers IV antibiotics and biologic treatments for chronic immunosuppressive disorders like rheumatoid arthritis or Crohn's disease. Matt McKelkey is the Infusion and Pharmacy Senior Director.
Infusion is any drug that you are getting that goes through an IV line. That can either be through an arm or a chest port. It's just one of those drugs that you would usually get inpatient, but we're offering it outpatient through our service.
Much of the infusion care starts in the pharmacy, where staff members make sure the medicines are prepared to be delivered safely in the right dose to the right patient at the right time. Jan Heister is recovering from a spinal infection, and she needs antibiotic infusions 7 days a week for weeks at a time. She sings the praises of the staff running the Infusion Center.
Kevin and Jen and Kathy are wonderful. They make this whole ordeal a little less painful.
Her nurse on this day is Kevin Outwater. He likes working in a department where he can develop a bond with his patients.
I like to get to know people, and we get to see the same patients over and over a lot of times, and so you get to build a relationship with them. Having these services in Estes Park help the patients to get the care they need right here in the town they live in.
The patients and staff enjoy the bright airiness of the window-filled Infusion Center.
And got a great view of Lumpy and Twin Owls.
I mean, we have the best spot in the hospital because we have all the windows outside.
Jennifer Godfrey is the other registered nurse who administers therapies here.
Just because we're a smaller hospital doesn't mean we're not proficient and efficient and doing everything correctly, and you're having great care, because you are. You come in, you get more one-on-one care, and you also get good and safe care as well.
Medical oncologist Dr. Matt Sorensen travels to Estes Park Health every other Monday to guide cancer patients' care. He says having the opportunity for chemo and infusions in Estes Park is a boon for patients.
Whenever we can remove some logistically challenging things from an otherwise difficult situation, that can be a big advantage. I think it's great when you can bring services to patients as opposed to patients having to travel to see you. I have a whole team of colleagues, down the hill that are ready and waiting, and the same kind of collaborative energy that happens there. So it's kind of like having a team from a distance. It's an honor to be able to come up here. I mean, obviously it's a beautiful environment, and it's a privilege to be able to practice in a place like this. So yeah, I love it. I love coming up here.
The community has been a big supporter of cancer care at Estes Park Health. The Estes Park Health Foundation raised thousands of dollars during the 2022 rooftop rodeo to benefit the Infusion Center.
The foundation works each year to support cancer care in the community through our Crowns for the Care campaign. The foundation wants to do anything it can to support Estes Park Health's goal of providing those services right here in our community.
It's good medicine to have chemotherapy close to home, because you want the patient not to have to go out of their way to get these life-saving treatments. Staff knows the people. You see them every week. You get the same nurses all the time, and that's what makes the difference.
So I have called Kaiser.
Kathy Martin is the administrative coordinator for outpatient infusion.
We build relationships where we carry on conversations from the last time. So it's a check-in time with them, and we know what they like. We know what they like to drink. I have a patient that loves orange juice, so I keep it stocked down here, and I know when he comes in that I pop the orange juice and take it to him, and he'll say, "You know what I like." We need the word to get out there that we're here and we're available for our community. We're here for everyone.
For more information about services at Estes Park Health, log on to eph.org. Estes Park Health, mountaintop medicine, quality care.